This is Immuno Africa, a podcast dedicated to spotlighting African immunology research.
I still remember very well the moment my interest in immunology was, ignited. I remember this topic, vaccination, variolation, and so on. So I imagined myself in the scenario. What is this about the body, the immune system that, organizes itself, kills itself, modifies itself, to protect against diseases?
Welcome to the Immunology in Africa podcast. I am your host, Welt Okete. In this episode, Dr. Rebecca Chukwuanukwu, an Associate Professor at the Nnamdi Azikiwe University in Nigeria, joins me to talk about a journey into the field of immunology and commitment to supporting next generation scientists. Currently a visiting fellow at the Friedrich Alexander University in Germany, Dr. Chukwuanukwu's research seeks to elucidate immune responses in various local contexts. If it's your first time here, kindly support our work by subscribing to this podcast and turning on notifications to keep up with new episodes. We're currently on Spotify, Apple Podcasts, Google Podcasts, YouTube, and other streaming platforms.
And my name is Dr. Rebecca Chukwuanukwu. So I'm an immunologist, an associate professor of immunology, working primarily at Nnamdi Azikiwe University. And at the moment also a visiting researcher at the Friedrich Alexander University, Erlangen-Nuremberg in Germany. So my background is in biomedical sciences. That means I'm a medical laboratory scientist. So I started after my first degree. I went ahead and you specialize in an area, that is, you choose an area of interest. So the area of interest that I went into was hematology. So after that degree, biomedical science was the basis for me. I actually believe it's a very good course in the sense that it broadens your view. You have a lot of information on different areas, hematology, microbiology, many other areas. So you have histopathology, so you have a lot of background information. So that was my starting point, and I really loved it. There's something about, that makes you really happy looking under the microscope or growing an organism and being able to identify the problem with a patient, the diagnosis. So it makes you, it fulfills you. I really wanted to do something like that. I was really interested. My interest was in that, but then, as happens many times, you start with something and then you develop an interest in a certain area. So yes, I still remember very well the moment my interest in immunology was ignited. That was like in a second year, I think second or third year microbiology course. I think that should be third year microbiology course. I remember this topic, vaccination, variolation, and so on. So when the lecturer then was talking about it, it just, I imagined myself in the scenario. What is this about the body, the immune system that, organizes itself, kills itself, modifies itself, to protect against diseases? Unfortunately, in those days, there were very few places where you could study immunology. So I tried at a point and then failed. There was nowhere in the South, East End that I had access to. So I went ahead and started going for a master's I went back to the University of Nigeria and started a master's in hematology, started to specialize in hematology, but I kept thinking about it. I kept, dreaming about it. This is my love. This is what I really wanted to do. And I applied for a master's degree outside the country while still pursuing the MSc in hematology. And I was admitted. But, it wasn't a straightforward journey, I must say. Certain things can happen. So I didn't, I wasn't able to go at the time that I felt I should go. And, I didn't get the visa, just a small something, visa, all these things that happen to us normally. I had a job, I was already employed, I applied for it, and I was hopeful. Fortunately, I didn't get the visa. So I said, okay, no problem. Let me go back and continue with my master's in hematology. But God has his way of doing things. There is a master planner. I always say, things happen at the best times. So that is exactly what happened with me, because the very next year, the university, that was the University of Nottingham, asked me, so with this refusal of the visa, what should we do? Should we defer it? Because I didn't even know about, some of those information. They said, should we defer the admission? I said, yeah, defer it. And forgot all about it. That very year, the very next year, sorry, not that year, the very next year was the very first time that the federal government started this TET fund, Education Trust Fund then, but now Tertiary Education Trust Fund. That was the very first time and the university employees, apply.
Yeah.
And yeah, I just, they said apply, and the time frame was so short. And I started to apply for some funding for my further education with my MSc at the University of Nigeria. But I just remembered, whoa, I have an admission letter from the University of Nottingham, but that was for the other year. So I just wrote them a mail within just a few, I just wrote them a mail just before the deadline to submit. I wrote them a mail and said, please, can you give me my admission letter if you deferred that admission last year? They said, yeah, sure. Within 48 hours, I had the letter printed out. So I just used it and applied. Lo and behold, I got the sponsorship. And of course, with the sponsorship, the visa was, a walk in the park. In fact, they actually called me to come and take the visa. And that is the story of how I started to pursue my dream in immunology.
Yeah, thank you. Thank you so much for sharing. And there's already that aspect of perseverance in your story that even though you didn't get what you wanted at first, you're able to make do with what was available, but that didn't stop you from going after what your interest truly lied in, which was in immunology. And despite the challenges, pursuing that interest also came with you. You were undeterred. So my next question would be, what has been your work so far in the field of immunology? What kind of projects have you embarked on? What kind of research have you conducted? And what were their goals? What are some of the findings you made from those studies? And the implications they would have for individuals?
Okay. So like I mentioned before, I already had a background in hematology, and I was doing some research on infectious diseases. For me personally, being from an area where infectious diseases are the greatest part and the greatest sources of morbidity and mortality, for me, infectious disease research is primordial. So I basically focus around infectious diseases. So I've had a lot of research, and with my background in hematology and immunology, so I at first started with, looking at the immune system, looking at hemostasis, and how the infectious diseases affect certain hematological situations. From there, I moved into how the infectious, host-immune interaction, basically. How infectious diseases affect, and being in an environment where we do not just suffer sometimes from one agent, infectious agent. You have co-infection. I started looking into co-infection. So basically, for instance, my PhD research was on Mycobacterium tuberculosis infection in the context of HIV, because these things happen together. How does it modulate the immune system? How much worse do people fare if they are battling this and this? Does it escalate it? And how much does it escalate it? And what is affected? So I started out, for instance, with my MSc studies to look at TB and then HIV. Then my supervisor then, I was saying, I'll rule out people that have malaria. My supervisor now told me, look, but we're in an environment where malaria often comes in. So why rule it out? Have a third group and research on this. And that's it. So I had it was really complex, but it was a good one in the sense that I was looking at HIV, I was looking at tuberculosis, I was looking at HIV, malaria, I was looking at TB, HIV, I was looking at, this and malaria as well. And it's made the research so much more robust. I've also had some research on other aspects that are not infectious disease. I've looked at diabetes, how the immune system is affected, and then, how they are modulated. But I must say that my strengths are basically with infectious disease research. So I've done hepatitis, I've done many others, a lot, including how HIV can, predispose you to certain infections, Cryptococcus performance, fungal diseases that that come in. So we've also done that as well. So I must say it's a bit wide, but then that is what we need. So basically I research on what we need.
Thank you so much. So I would say something that was really interesting about the research or studies you shared was the fact that you were focused on diseases that were relevant to our population, to the communities that you were interacting with, and which is very important, because sometimes we just want to do some kind of studies that make sense, maybe in the very popular, that looks so grand, but you want to look at what's the relevance to our communities, to our populations over here, and you're trying to find the connection, and it's not really there. So I think the fact, like you mentioned, that you even had to include malaria in your study of tuberculosis and HIV co-infection, because that was a scenario that was also possible in our community. So well done with some of those studies looking into hepatitis and also HIV predisposing you to certain infections, including fungal diseases. So the next thing I want to ask will be, so some of these studies you've conducted, maybe you can highlight one or two of them. What were the findings you got from them, and what were the implications or relevance of those findings? How maybe those findings would have contributed to managing or treating the diseases? How would those findings would have contributed to helping individuals who had those diseases to cope? So let's hear from you.
I'd say that one of the most impactful to me was, anyway, all of them are impactful in their own different levels, but one that really touched me, that was of interest to me, is for that research I was telling you about concerning the TB and HIV. Remember, I was telling you that I, at a point, wanted to rule out malaria. But one of the major findings that we found out from that research, was in looking at the immune system and how it interacts with co-infection. We're able to detect in that research that being infected with malaria and tuberculosis at the same time skews the immune system to react in a different manner compared to the individuals who were suffering from just malaria. Certain things were upregulated, which would help them who were suffering from just malaria or who were suffering from just tuberculosis. Certain things were observed. These people are on directly observed treatment. So their immune responses were not similar. They were not particularly similar. Those that had malaria as well as tuberculosis, instead of reacting in the inflammatory nature that they should react to be able to, to heal from the disease, respond with the aid of, drugs and then the immune system itself, they were acting in a different manner. They were, how do I explain it in a simple term? The immune response was anti-inflammatory. It was trying to downregulate the inflammation in order not to cause harm. But by doing that, it was now jeopardizing the body's ability to now fight tuberculosis. So when you have co-infection with malaria and TB, something has to give. And what was given was that the people who had TB and malaria were suffering more from the effect. Their infection with tuberculosis was not as well controlled as the others. So that was a major finding, and findings from that research actually got me a prize for the, outside the shores of Africa. So I think, that was an important finding to me. So it was surreal, seeing how the immune system was responding. So that was an interesting one for me.
Really, really interesting. So what you were saying was that individuals that had both like malaria and TB, the co-infection meant the immune system was downregulated. So the immune system was not doing what it was supposed to do to fight diseases. So in a way, the diseases could worsen. They had worse outcomes compared to those who had just one of the diseases.
yes, it had to adjust. It has to adjust. Trying to do this, trying to do this. It's just considered like serving two masters at the same time. Should I do this? Should I do this? And then it balances itself, but then not giving the best for the particular for this particular type of infection. So yeah.
Interesting. So yeah, you just mentioned, because I actually saw that award when I looked you up on Google. So the award that this research brought you. So I think you should just tell us about it in 1 or 2 minutes. So let's know. Let's be able to weigh in on the impact, the immense impact that the research had.
Yeah. So after that PhD research, I got, the first thing that happened when I knew it was really good, I was writing up my thesis. When I knew it was really good was I applied to the ASM, American Society for Microbiology, and put in my abstracts. They immediately invited me for an oral presentation. They wanted to hear more. What is this all about? That was the first inkling that this was an impactful finding. And then subsequently, there was this UNESCO-Merck, contest that came out, and I saw it and I applied for it. It was like they were, UNESCO was collaborating with them, and Merck is this drug company in Germany, so they advertised and they were funding it. So I put in my abstract and so on, and I went, and I was selected, and I was fully paid sponsorship to Switzerland. I was, of course, very, very excited, but I didn't even know, how, what was coming. Not even when I got a call, like, are you sure you're going to be able to attend this event? We want to know that you're. I said, yes, I'll be attending. Unfortunately, I didn't know anyone else who had been selected to ask the person, did you get this call as well? So I felt everybody who had been selected was being called to attend. So I didn't know anything special, but they had seen my research, asked for more information, wanted to know more, asked me, literally talked to me on the phone, like almost like an interview, and then selected me. But I didn't know how far up I was selected. I thought I was just selected to attend, to go and see who won this thing. And there I was. When I was announced the winner, I was in shock. So it was that PhD research, like I told you, it was rather difficult for me. And you know how it can be, expensive. I had to like save up my salary. Like I told you then, it was a bit like I was wasting my money. Like I told you, I had my master's degree in the United Kingdom. Even before I finished my MSc, I got an admission to, have a PhD there, but there was no funding attached. My supervisor then did not have funding. So I didn't have the funding to continue, but she encouraged me. She said, okay, since you already have a job in Nigeria, let's work together. I'll help you. She helped me with, certain information, she donated some reagents, some small things, culture materials to me. She donated some to me. And then I saved up and bought, what I needed. So it was really expensive. And I kept lamenting, this is such a costly thing. I don't have funding. This is such a costly thing, but in the end, it was a worthy investment. I must tell you that it was a very, very worthy investment. So all that effort made the research stand out, such that I won that first prize, and the first prize came with my first, postdoctoral fellowship outside the shores of this country. So that's it. So I was awarded a fellowship to Germany, and yeah, the rest is history, as they say.
Yeah. Super inspiring story. So the first question I'm tempted to ask outside of your research is, how do you try to support some other younger or emerging scientists that you've been able to mentor or lecture or, supervise over time? So what have you tried to do differently to, let me say, maybe cushion the impact or effect of the challenges associated with doing research in this part of the world?
Okay, so let me start from, like I told you, I was inspired to study immunology.
Yeah.
And one of the most inspiring things is that I felt that the person that inspired me was a very good teacher. he did his homework and not just a sloppy teacher. He knew what he was talking about. And there's a way you command the audience, you command your people, and they learn and they remember. So one of the things that I always wanted to do was to teach. I wanted to be a lecturer. I wanted to be a teacher. I come from a family that, my mom is a teacher. She started from elementary and then went to, she started from elementary teaching and eventually went to secondary school teaching. She's a very good teacher. Everybody knows that. People always commend her. You're a born teacher. So I also felt that I wanted to be a teacher, but you know how it can be. And everybody like, no, you can do more than that. No, you can be a this, you can be a that. But in the end, I found, I can have the best of both worlds. I also liked, like I told you, looking under the microscope, looking at things. And then there's this, you can teach and you can also research. So I found my niche. So I teach, I make up my mind. Immunology can be seen by many people, even here in Germany here or everywhere I've been abroad. When you tell them what's your field, immunology, they're like, the difficult part. Immunology, the hard parts. My physician here, he just like, immunology. Oh, I hated immunology as a student. So people feel, it's complex actually. It can be very, very complex, but it's such a wide area that I tell people you can always find an area to love, an area that you can like and, work with. So immunology is complex because the immune system is it's complex. Just imagine just think about it. This system has never seen anything like COVID. But believe you me, you and I are, have some level of immunity to COVID as we speak. The majority of the population, so that if it happens, if that same one that came that time, not a mutated one, comes in, your immune system is ready for it. So it has the ability to change itself to meet the challenges. So for that, it is a highly complex system. So to get your head around it, it's not an easy thing. It's not an easy thing. However, I always try to start small. So teaching, I take my time with it, I prepare for it, and it gladdens my heart when I teach and my students are like, no, you're absolutely wonderful. When I come into class, I say, please, keep quiet, listen to me, and then, and I see them being spellbound. I start small and hold them step by step and go. So that is something that I'm giving back from understanding something important, I want them to also understand. And from that, you see people starting, it makes me proud to see people starting with courses that are really not so related. I have an anatomy student, and then after teaching, he's like, no, immunology is it for me. He's here in Germany studying immunology. So that is it. That is my impact. I have people that I inspire, like, if you're able to do this, we can do this. If you're able to study this, we can study that, and so on. So that is it. I believe that inspiring people is important and they learn. So that is from undergraduate. Then I have the postgraduate people that I teach. I have postgraduate students. I have people that I teach, sub courses, microbiology. Then I have the MSc immunology students. I have those that are doing PhD and so on. So these are the people that, gradually you give them what you have and they learn and then they progress. So I try to expose them to the conferences that I like, apply for this, apply for that. This will help you grow. Those things are important, I also encourage younger ones, move. One of the things that I will never regret, like I told you, it was difficult to get, places to interact with people. At a point, I was a student, but I didn't know I had to go to conferences. I didn't know I had to get up from Anambra and go to Ibadan, or go to here or go to there to meet with people and be inspired by them. I didn't realize that at a point, but eventually I did. And those things, you fund it out of pocket. The gap is much. Here I see the postgraduate students, they like, they see a conference and they apply to a university. I want to go to Vienna, and attend this conference of white blood cell conference. And they are funded and they go. Definitely they'll see others there and they'll be inspired and they'll meet people, they'll, interact. To do such, you have to save for a year and then go. Like I told you, I presented a paper at the American Society of Microbiology. I paid for it fully out of pocket, you know, and that is the, how do I say, that is the reality of most of us in Nigeria. You pay for it to be able to attend these things. You pay for the hotel, you pay for the conference fee, you pay, everything is so costly. And, you know, some people may consider that you're a fool to spend that much when you could use it to put a down payment on something for yourself. But in the end, to be an academic is not cheap. I must say it. It's really saddening sometimes when you see the situation. They want you to publish papers, you know, you have to be published or perish, and then nobody pays for the publication fees for those things, which means that we often fall into, you know, predatory journals that will take $100, $300 from you, because those big ones will charge you $2,000. Where in the world can you get $2,000 when your salary a month is less than 400? You know, I don't know what it is right now. So that is the situation. But in all, we keep pushing. Once in a while, we beg and we beg, and we tell them, I'm from so place, I can't afford this. They say, oh, Nigeria is not in the this category, and you keep on writing and pleading. Sometimes they listen.
Exactly.
So where there's a will, many times there's a way.
There'll be a way. Yeah. Thank you so much. So I think it's interesting how you've woven lots of pieces of advice into the question I asked initially. So thank you so much. And I love the fact that you are really deliberate about supporting the younger generation, those who you are mentoring, you're lecturing. It's really, really important, and it's inspiring that you're doing all of that. And, you know, also finding a way to still cope with the challenges you still have to grapple with, because even though you now get to support and mentor other persons, that doesn't exempt you from challenges. You still have to grapple with multiple challenges. So well done. So the next thing I want us to talk about is your recent fellowship at the Friedrich Alexander University in Germany. So tell us how you got it, and what kind of research you hope to conduct there.
It's really interesting how, you know, things move and how things happen. I remember that when I finished my PhD, I heard about such a fellowship. I think I saw it either online or somewhere, and I read it and I felt like, in a couple of years, this is the kind of thing I want to do. I thought about it then, and I put it somewhere. I slotted it somewhere into my thoughts. I knew at that point in time, right after my PhD, that I wasn't qualified because I didn't have the papers, I didn't have the experience that they needed, and so on. But then life happens. I got busy with work, I got busy with this, I got busy with that. Remember, I told you that I thought about it, and I said, in a couple of years, I'll apply for this. The couple of years soon, you know, went over, and I was no longer qualified for the postdoc aspect of this Alexander von Humboldt Fellowship. I was no longer qualified for it. I had just stepped out of the I had stepped out of the postdoc area, and I'm like, where did the years go? What happened? How did it happen? You know, but then they also have an experienced researcher, senior experienced researcher fellowship. So I now looked at the experienced researcher fellowship. I said, oh, I'm not qualified for this yet. You know, I thought about that, you know, just 2 or 3 years ago. I said, no, I'm not qualified for this yet. I said, no. But what is the harm in trying? Start, do it. So I just sent a note to myself, do this, publish this, do this. In a year's time, I will apply for this. I noted it down to myself. I felt I may not be so qualified, but by then I had stepped into the range where I felt I was beginning to be qualified. I made a note to myself. I put it in my phone ahead of time. And by the time it was that a year later, I said, now it's time for this. I think this is the time for this. And I think everything has set up my, how do I say, my responsibilities. You know, of course, as you grow, you have students, you have people you supervise, you have, how do I say, you know, administrative responsibilities. I was the head of department at the time that I was applying for this, but I felt I've done this head of department for 2 years. I think I can give time to developing myself and not focus fully on administrative, because the truth of the matter is when you get to certain levels, certain positions, you so focus on it that you don't have much time for yourself. You see yourself every day, you're working for this, you're working for the students, you're working for this. And, I was actually growing a new department. So you can imagine everything from scratch. So it was totally consuming. It was consuming my time and everything, but I think it's time to apply. If it goes, it goes. If it doesn't, let's just say it like that. And I sat down and I applied for it carefully. I did everything, and by the special grace of God, it was the will of God. And then, I was among those that were selected, the few that were selected. So it was really amazing. So yes, this fellowship, that is how I got the fellowship. I applied for it. I had planned for it. The point I wanted to make is I had dreamed of it and I worked towards it, and I didn't rush it. Many of the times when you're applying for something important that is highly competitive, it is important that you begin on time. If you can't make it as perfect as you want it to be, do it the next year. Do it the next cycle if you have that opportunity. So I started, and when I felt I was satisfied that this application looks as good as I wanted it to be, I said, yes, I can go with this cycle. And I applied, and by the grace of God, it's just not me. You can prepare as good as you can, but the opposition, the competition can be so steep. But yeah, I fell in among those that were selected, and here I am. Working on this. So my research here is basically on, like I already said, infectious disease research is primordial to me. So here I met, someone whose interest aligned with mine. So here I'm a researcher, so I'm just working with someone, the opportunity being that I have the funds that I need to do the research to my heart's content and do it in an environment that provides me the opportunity to do it more in depth than I can do it back home, considering I have many equipment at my disposal that I do not have back home. I have things at my, everything. So that is the situation. So I'm working on trying to look at, the immune system and how it reacts in the context of malaria and pregnancy. So I'm looking at neutrophil extracellular traps. That's the new way, not relatively new way, which neutrophils are able to, release their DNA and try as much as possible to trap pathogens. So, but sometimes in trying to stop the microorganisms, they can also cause harm. Immunity comes at a price. We all know that. So something can be harmed. So what harm is being caused by the neutrophils interacting with malaria, in pregnancy? So that is what the research is all about. So it's still hush-hush. We're still working on it and looking at it, and that's what I'm working on right now.
Congrats again on getting the fellowship. Of course, it's really deserving that you got it, and I'm looking forward to the research or the outcome of the research that you're currently working on there. And I believe it should come with at least one publication. So we'll be watching out for that publication, and looking forward to the findings that the study would come with. One question I'm interested in asking also is, what to you is the most fulfilling part of your work, in whatever context you want to look at it from?
That's actually a good question, but a difficult one to answer, because, what would I choose? What would I choose? It's for every aspect of my life. I have the high points, I have the highlights. I am wearing many caps. I'm a teacher, I'm a mentor, I'm many aspects of my career. I know, the joys I have, over time. I remember starting from the beginning, you won't realize how much you can do, or you can help, or make an impact, or help by being you and doing your job well. Thinking about everything, having the information you should have. For instance, as a medical laboratory scientist, I remember, walking, and somebody came to me. I was just in the lab working, and this very poor duo of women walked in and told me that, look, that all they have is just this amount of money, but that this woman here is sick, but that they don't know what is wrong with her, but that this is all they have. Make your choice of what you should do. I told them, please, can you go to the hospital? They said, no, we can't even afford to go to the hospital. Just check and see if you will find it. If not, let's just go back and, and leave, forget it, and whatever will be, will be. I just looked at how wretched they were and everything. I said, okay, I just said, okay, let me just do this. And you won't believe it. The diagnosis was, I was able to find out what was wrong with that woman with the cheapest of tests that you can think of. She just had a urine analysis without even a culture. And I spun down the urine, and there I saw schistosoma hematobium, which was what was causing all the bleeding while she was peeing and everything. This is an elderly woman in her 60s. Once I saw those shiny things under the microscope, I was so elated. I was so happy. I kept revolving around it. And that is it. I said, madam, you have to go to the hospital. There is definitely something that is your problem. With a little drug, this is drugs that people, just a little drug, you're fine. So like that is a high point. So my high point as a teacher, that's a high point as, for diagnosis for me.
Mm-hmm. Yeah, I understand.
That is it. And they were able to be convinced that since they already had a finding, that it wouldn't be too expensive to get them to drugs, and then they'll be fine. And they were encouraged to put in more for their health. And that's it. That woman was fine. So that was a huge impact for me. I could have said, no, madam, this, but I was very happy. So that is for that aspect. As a teacher, my inspiration is seeing people, talking to people, teaching them, and they learn, and then they get back to me sometime and said, you impacted my life. They do it from everywhere. Some of them don't have my phone. They even reach out on Facebook. I usually tell them I don't, for my students, just please leave my Facebook. But when you graduate, you can be my friend. They reach out and then they send private messages or something. After they've graduated, they're my friends on Facebook or something. They send me messages or something and say, look what you did in my life, what you did in this, what you did in this. That makes me so fulfilled. I was a course advisor for a particular year, and I just noticed like someone who wasn't doing so well. I didn't know what the problem was, but I just asked to see him, and I sat him down and I talked to him. I knew nothing about his situation or what the problem was, but I really talked to him. Years later, he came back and told someone that, look, that I saved his life. I was in shock. He said he had decided to commit suicide, but I didn't know it. All I knew was this person, when I see him in class, is lost and he's not doing so well. And he had some challenges, which I knew nothing about. But I talked to him and I said, you can always talk to me. All he needed was just that push, and he was okay. He'd come around and say, I don't know, but I didn't realize the kind of impact. So such things, I don't know how to explain it, but there was a reason why I was there at that time. Yeah. So such things help. So as a mentor, as an advisor, that is a high point for me. Making impact to the students, making them feel that they are loved, or making them feel that they have a safety net. They appreciate it. Of course, some don't, some don't care, or some feel but still, those ones that appreciate and like, I don't need anything from them. I don't need you to give me a bottle of wine or buy me this or that, but that's thank you. 2 years ago, you did this for me. It's everything. It's everything. So it makes me feel like I'm doing something good in life. So what you give back. So that is it for me. So as a researcher, the outcomes, if I'm able to like say, please let's screen for malaria among these individuals that have tuberculosis, treat them for malaria, and then they are good to respond well to their TB drugs. that is an impact to me. Any little helps, yeah, I've had occasion to doing some research and someone says, no, I refuse anybody collecting samples from me, but I'll let you because, you were kind to me, or you didn't mind when I said no, you just said no problem. And then you walked away, and then I decided you collect the sample and help me research, something like that. So of course, we're not in a good mood every day, but when somebody calls you back and say, yes, thank you for this or that, you really appreciate. So little by little, is a matter of being intentional, a bit at a time, every little at a time. So yeah.
There's that aspect of intentionality to your work. There's that aspect of intentionality to the examples you just cited, your approach to research, to teaching and mentoring, and to the diagnostic aspect of your work also. So it's really fascinating that you are really deliberate about everything you do and making sure that you are making impact, impacting people, transforming their lives and helping them see possibilities, even when the clouds are all dark and there isn't any factor of encouragement for them. So well done. And thank you so much for the robust conversation so far, talking about your research, your journey, the contributions you've made, and all that has happened so far, also getting your perspective in the context of your work. So we are already coming to the close of the interview, and I would like to take your closing remarks and final words now. So perhaps if there's something else you didn't get to touch during the conversation, you can also mention it. But in the totality of the conversation, like summarily, what is that one thing you'd want listeners to go home with?
My closing remarks and advice would be that whatever your interest is, of course, our interests are diverse. We can like something different and totally so, but whatever it is that keeps you awake at night, that you can actually do and stick to it, not get bored by it, try to make effort to pursue it to the best of our ability. It mustn't be academic. It could be in a different thing. It could even be in, businesses, anything that you want to do. Just try as much as possible to improve yourself so that you have enough knowledge and you have enough information to be able to do it. Nobody is a saint. I'm not a saint. I'm not, nice all the time. I get like every other person. I can get upset, I can get frustrated, I can get annoyed, I can, so that's it. I can be very firm, but just try as much as possible that the way you were yesterday is better than the way you are tomorrow. Every opportunity you have, every occasion is an opportunity to learn. Pick something out of it. This didn't go so well. What did I learn from it? Or this went so well. What did I do right? So use it as an opportunity. But above all, try. Even when you apply for certain things and you don't get them, what's the worst case scenario? You didn't get, so what? But if you apply, you have an opportunity of getting.
Yeah.
You are in. Just like if you don't buy a lottery ticket, there's no way you're going to win. I'm not saying buy lottery tickets or play, all these things. I'm not saying, but if you don't put yourself into the loop, you have 0% chance of getting an opportunity.
Sure.
But if you make an effort, if you step in there, you're in the ring. So you can either be selected or not selected. But once you're outside that ring, there's no chance of being selected. So I keep on telling people, someone says, should I apply? I say, why shouldn't you apply? What is the worst case that can happen? No. Someone can say, oh, should I ask this person? I don't know. I want to ask all these Oyibo people, but I don't know if, what can happen? They ignore your mail. And then nothing off your face, nothing off your skin. You try again and try again. But if you're making effort to get an interest in something, do your homework so that you have the opportunity of impressing. Say, for instance, now, I want to get someone to be interested in me as a researcher, or I want to work in your lab, or I want you to give me a postdoctoral position, and I'm interested in your work. I read about you, about the research you do, and ask intelligent questions which will pique your interest. And then you'll say, oh, maybe this one. So something like that. So my advice is make efforts. do the best you can and leave the rest. God knows everything and He knows what is best for you. So long as you're doing your best, yeah.
Thank you for listening to this episode on Immuno Africa. If you enjoyed it, please feel free to share it with your network. You will learn first about future episodes and get other immunology related updates by following Immuno Africa _other Immunology in Africa podcast on social media. See you on the next episode. Bye.